Hey guys, I got another video for you, but
What's up, guys? Yep. Yeah.
Wait.
I just want to say really quickly that as long as we are out there and kind of isolated on lockdown, I'm going to continue to make videos and create online education. So stay with me and stay healthy and stay safe.
And stay educated.
Yep, that too. All right.
Yeah. All right.
Bye.
See ya.
So this video is a follow-up to my draping and stretching video, supine, that I released recently, and this one is prone. So the first thing I'm going to do is flip my client over, and a couple important things to note is that I'm holding the sheet and the blanket like a tent. So you want to make sure your client has enough room to flip over and scooch up and lie face down in the face cradle. Once you've got him face down, exposing his back is pretty simple, but one of the best tricks is to pull their arms outside of the drape so that their hands are holding the drape in towards their hip. From here, you can do lots of amazing little stretches into the low back and into the hip. But for now, the one I'm going to emphasize is pulling one arm off the table at 180 degrees and taking some time to use one hand to pull down on the hip and using the other hand to push up on the lower paraspinals. This offers some space to the low back and creates some nice breath into those dense muscles. Remember that even some gentle compressions can offer a slight stretch into very tiny muscles that don't often feel that isolation. When I'm ready to bring my client's arm back up to the table, remember that anytime you offer a joint mobilization, you want to also offer some traction. From here, I simply lift the blanket and the sheet a little bit, tuck his hand back to his side, and pull the blanket up over his back, making him feel safe and tucked in. Moving down to the leg, I'm going to access the edge of the sheet in the same way that I did when my client was supine. I'm leaving that edge accessible right on the medial aspect of his lower leg, and then I'm using my right hand here to lift the leg up from the hip, but holding underneath the knee, and using my left hand to pull the sheet from the end of the table near me up towards his hip. After you've done the work you want to do on the hamstrings and the posterior leg, it's time for a quad stretch. So I'm picking up my client's ankle from the front of the ankle and making sure that I press down into plantar flexion as I push his heel towards his glutes. A nice tip here is to push the heel in 3 different directions. So starting with the middle line and then pushing his heel medially and then pulling his heel out laterally. Each of these 3 directions offers a different stretch into the quads. And then of course, if you've got somebody who's hyperflexible, picking the leg up off the table increases all of this. I'm not even going to pretend that this is an easy move to do, so if it helps, lift their leg up and slide your knee underneath their knee. This is going to increase the stretch in the quads and make it a lot easier for you to use both hands to lean down into their knee flexion, using your own core strength to create a nice deep stretch. It's important to remember to keep their ankle into plantar flexion because this is going to be what unravels that connective tissue that stems all the way from the ASIS in the front of the hip, through the patella, into the front of the ankle, and into the metatarsals. Once you've placed his leg back down on the table, this is an awesome moment to transition into stretching out the calf. So I'm mainly pushing his toes up towards his knee with his knee in different positions. Because the gastrocs cross over the knee, if you bend the knee, you're taking them out of the equation and mainly stretching the soleus. But the more you extend the knee, the more you're getting both of those muscles. So either way, pushing the toes towards the knees is going to be a great calf stretch. Moving up to the hip, I've demoed this figure 4 stretch before, but I wanted to offer a couple of extra tips for draping and a couple of extra techniques for stretching. So I've got his lower leg between my 2 hands, and I'm levering his ankle medially, creating an external rotation in the hip, and I'm bringing his knee out laterally. From here, I want to make sure I tuck the drape down around his thigh and use my own hip as a protective barrier so that his leg doesn't fall off the table. Of course, if his leg does fall off the table, you can always pretend like you meant for that to happen and extend his knee out and do some awesome work into the hamstrings. I've got my left hand supporting his knee so that it doesn't hyperextend and also lifting it from the floor. Or I can lever his lower leg down using my left hand again to support the knee and my right hand to do the heavy work. But another option is to hook my lower leg into the lateral portion of his lower leg and using my bent knee to push forward, leaning back with both hands and creating an amazing hip twist for that client who is just hard to stretch. As always, apply a little traction when you're done because at this point, it's just the icing on the cake. A special heartfelt thank you to all of my patrons over on Patreon. I would not be able to do this without you guys. If you're interested in supporting what I do on Patreon, please head over. I've got lots of extra tips and tricks that you guys can practice on your loved ones during this lockdown. Stay healthy, stay calm, and stay educated.